factors. A single risk factor may be enough to cause heart failure, but a combination of factors also increases your risk. The risk factors include high BP. Your heart works harder than it has to if your blood pressure is high. Coronary artery disease. Narrow arteries may limit your heart's supply of oxygen-rich blood, resulting in weakened heart muscles. Heart attack. A heart attack is a form of coronary disease that occurs suddenly. Damage to your heart muscle from a heart attack may mean your heart can no longer pump as well as it should. Diabetes. Having diabetes increases your risk of high blood pressure and coronary artery disease. Some diabetes medications, the diabetes drugs called rosiglitazone and pioglitazone, have been found to increase the risk of heart failure in some patients, but do not stop taking these medications on your own. Certain medications may also lead to heart failure or heart problems. These medications will cause heart problems and increase the risk of it. These are usually non-steroidal anti-inflammatory drugs, certain anesthesia medications, and few antiarrhythmic medications. Sleep properly while you sleep at night results in low blood oxygen levels and increased risk of abnormal heart rhythms. Both of these problems can weaken your heart. Congenital heart defects. Some people who develop heart failure were born with it. Valvular heart disease. People with valvular heart disease have a higher risk of heart failure. Viruses. A viral infection may have damaged your heart muscles. Alcohol use. Drinking too much alcohol can weaken heart muscle and lead to heart failure. Tobacco use. Using tobacco can increase your risk of heart failure. Obesity. People who are obese have a higher risk of developing heart failure. Irregular heartbeats. These abnormal rhythms, especially if they are very frequent and fast, can weaken the heart muscle and cause heart failure. The complications of heart failure are kidney damage or kidney failure. Heart failure can reduce the blood flow to your kidneys, which can eventually cause kidney failure if left untreated. Kidney damage from heart failure can require dialysis for treatment. Heart valve problems. The valves of your heart, which keep blood flowing in the proper direction through your heart, may not function properly if your heart is enlarged or if the pressure in your heart is very high due to heart failure. Heart rhythm problems. Heart rhythm problems or arrhythmias can be a potential complication of heart liver damage. Heart failure can lead to a buildup of fluid that puts too much pressure on the liver. The fluid backup can lead to scarring, which makes it more difficult for your liver to function properly. Some people's symptoms and heart function will improve with proper treatment. However, heart failure can be life-threatening. People with heart failure may have severe symptoms and some may require heart transplantation or support with a ventricular assist device. Prevention. The key to preventing heart failure is to reduce your risk factors. You can control or eliminate many of the risk factors for heart disease, which are high blood pressure and coronary artery disease, for example, by making lifestyle changes along with the help of many needed medications. The lifestyle changes that you can make to help prevent heart failure include not smoking, controlling certain conditions such as high BP and diabetes, staying physically active, eating healthy foods, and maintaining a healthy weight, reducing and managing stress.